Namaste. Greetings from all of us at Apollo Hospitals. Welcome to our corporate health series. This is Dr. Srinidhi Chidambaram here. I do hope that you're finding these sessions on health and well-being useful so that you can derive the maximum benefit out of them and enjoy a very productive and successful journey ahead. To keep the body in good health is a duty. Otherwise, we shall not be able to keep the mind strong and clear, said the Buddha. And communities and countries are really only as strong and healthy as the health of their people, especially their women. Thus, there is a strong case to foster women's health, and there is an immense need. We dedicate this month to several insightful sessions that focus on women's health and well-being, not just because of International Women's Day, but also because of specific reasons. Women have unique health risk factors, unique propensities to some diseases, and symptoms for some health problems are not always recognized in women, or they may differ from those that men experience and often go unnoticed. And above all, women are prone to putting off seeking health care. And when it comes to women who work, there is an even greater tendency to keep pushing it under the carpet and postponing seeking medical care. A common term that we hear very often these days is PCODs or PCOS. This is one condition that is often ignored, but hormonal imbalances and irregular periods are sometimes caused by this condition, and this is also one of the commonest causes of infertility. So why is it important to be aware of this condition? It affects a lot of women. It has a lot of future complications as well as issues with your fertility, with your menstrual cycle. And it is something that is often linked to future health problems like diabetes or high blood pressure. So it's very, very important to know all about this condition. So let's find out more about PCOD and PCOS from our eminent gynecological specialist who has joined us here today, Dr. Roma Sinha. Dr. Roma Sinha is a senior consultant gynecologist at Apollo Hospitals, Jubilee Hills, Hyderabad. She brings over 28 years of expertise in OBG, renowned as India's most experienced robotic gynecology surgeon. She pioneered robotic surgery in the country in 2012, specializing in complex gynecological surgeries, including a record number of robotic surgeries in gynecology. Her areas of special interest include fibroids, endometriosis, pelvic pain, and abnormal uterine bleeding. As an honorary professor at AHERF and conjoint associate professor at the Macquarie University, Sydney, Australia, she has earned recognition as a distinguished clinician at Apollo Hospitals. In 2021, Dr. Sinha's career is adorned with many, many distinctions and awards, and she is celebrated for her passion and expertise in treating women with conditions like endometriosis and fibroids. A gold medalist in MBBS from the Banaras Hindu University, Dr. Sinha has garnered prestigious awards such as the FIGO Fellowship in 2000, the AOFOG Young Gynecologist Award in 2002, Legend of the Year in Gynecology in 2017 and in 18, Best Laparoscopy and Robotic Surgeon in 2018, Excellence in the Field of Medicine by FICCI in 2014, and many more. She has contributed to medical literature as well with book chapters and research papers, showcasing her people-centric approach and her commitment in advancing the field of women's health. Thank you so much, Dr. Roma Sinha, for joining us. It's great to have you here with us. So we look forward to hearing your valuable inputs about this condition.
First of all, namaste to everybody. And thank you, Srinidhi, for a lovely introduction. Very kind of you. It's really indeed, I'm really happy to be with all of you today. As Dr. Srinidhi said, it's a very important, I would say even a burning topic in women's health today that we call as PCOS. So let's take the conversation forward. Thank you.
So let's begin, Doctor, by asking you to explain this term. I think, as you yourself said when we were talking before this session began, everybody bandies about the term PCODs or PCOS as they please. But what is it exactly? Can you explain that in simple terms? And what is really the difference between PCOD and PCOS?
To begin with, maybe 2 decades back, we were calling it as a PCOD, which means polycystic ovarian disease. D definitely means disease. But over the years, we have understood that it's not just a disease. It's like a condition of a body. There are many facets involved in it. And that is why today it earns its respect by being called as a syndrome. We know in medical terminology that whenever we say it's a syndrome, that means there is too many things together, and that brings a clinical picture. So today it's called a polycystic ovarian syndrome. And as the young kids today call themselves as PCOS, I have PCOS, or do I have PCOS? So that's what they're trying to figure out. As I said, it's a condition of the body. In a very simple term, you should understand that's a combination of some metabolic disorders that's taking in place of you, which is representing externally as a hormonal imbalance. And that can bring you to a doctor's chamber with 2 or 3 problems. One could be irregular periods. The other could be some kind of, facial acne or hair or something, or it's just the weight that's not going away. So these are the common symptoms that bring your notice to something going wrong in your body and our suspicion that am I dealing with a condition of PCOS in you?
So what would be the key symptoms of this condition that working women, particularly who really do not have much time, should be watching out for?
All right.
Perhaps looking out for their family members, their daughters, maybe.
Okay. I understand this is a session especially for corporate India, and I see. And I believe, and I'm very happy that in corporate world also, there is more and more involvement of women force there. And women are not just the regular one, but they are also in high decision-making positions and doing their best. The commonest symptoms, as I just mentioned, will be the commonest reason for they walk into my office is irregular cycles. And the irregular cycles, that means that they will have delayed cycles. That is the usual story. And the delayed cycles are usually followed by either a very heavy bleeding or a prolonged bleeding. So that's the commonest reason that they present to my office. Otherwise, as I said, they may present to a dermatologist by saying they have acne or hirsutism, which is not going away or they're not able to do. The other thing that they sometimes don't come directly, but there is an associated problem of obesity in these women. So these are the common things which an average young woman will be able to understand. But as they grow into their reproductive age group, sometimes when they get married and they're planning a pregnancy, they are unable to get pregnant. And PCOD or PCOS would be one of the major leading factors or causes for them not to get pregnant. So that's another reason why they could present.
Right. So we were talking about irregular menstrual cycle, irregular periods. So there are many other causes as well for menstrual irregularities. So what would be some of the other causes which could also be contributory, or is it something very exclusive to PCO?
Okay, let me make this very simple, and that's how I actually teach the young MBBS students as well. So when you're talking about women and we ask them how is your menstrual cycle and how it's going, there are 2 parallel thought processes. One process is if the woman is having regular cycle, that means the cycle is coming every month, but she's either bleeding more or less, that could be a structural problem in her uterus and ovaries. So that could be fibroids or adenomyosis, which is causing heavy bleeding and pain and all those stuff. But if the cycle is irregular, that means either cycle coming too fast or too late, then there is a hormonal issue. And we have to understand that it's not just the uterus and ovaries that bleed. It is the signal of hormones right from our brain, that is the hypothalamus, to pituitary to ovarian. So there's an axis, hypothalamic pituitary axis. So if there is any disturbance, then the woman will have irregular cycle. So that could be, for simple reason, stress. Exam stress. Most people listening would understand that during exam, either your period will come too fast or too late. So it's a simple stress that is happening, or your workplace, there's a deadline to meet, and you find that your periods have got preponed or postponed. So these are common reasons for disturbance of the hormone. So there could be structural problem in the uterus ovaries, or there could be a hormonal problem. So these are the two vertical lines that we have to look into, and these are the common reasons for having abnormal bleeding. PCOS is a hormonally induced problem. So there's no structural problem in your uterus or ovaries.
Are there any particular risk factors or maybe some hereditary factors? So who gets this?
Okay, you need to have a genetic predisposition for it. That's important. The genetic predisposition gets then over or compounded by environmental factors. And commonest environmental factor, two things I would say: bad diet and no exercise these days. There could be many other things, but these are definitely something that affects for the PCOD phenotype to actually present themselves. You understand?
Right. So could you elaborate a little more on that when you say bad diet?
And before I actually start the bad diet, one more thing that I'd like to, for the people listening to understand, is there is a connection between a family history of diabetes as well, because I'll come to that in a minute, where we are talking about insulin resistance in these patients. So the diet that you take sometimes is not assimilated in the body as it would be to your friends, because you have peripheral insulin resistance, which is the same metabolic disorder which you'll find in type 2 diabetes. Okay, so just try to link that. If you think you have PCOS, is there somebody in your family has diabetes as well? Because you're running the same genetic makeup. So diet, high calorie diet, high sugar diet, a lot of pre-processed diet are the ones, or high glycemic diet, these are the ones that a patient with peripheral insulin resistance will not be able to digest. Up after 2 decades, but that can cause a hormonal imbalance presenting as abnormal bleeding.
So what happens if this particular condition is, you just ignore it, like, because many times one notices these are not like very severe symptoms, like, one doesn't misses a here, there, weight gain, something. So people always, it's quite an easily ignored condition. What happens when this happens? Like if you just leave it without addressing it?
Okay, so let me just take it in the age group. If you're a young patient, not having periods, sometimes you're happy, okay, I don't have to deal with it every month. But what would happen is that when you bleed after 2 or 3 months, you may bleed heavily and a prolonged bleeding, and then you need to take care of it. So that's one problem that can occur. The second problem that occurs when you are a little bit older and you are looking for a pregnancy, you actually don't ovulate very well. When your eggs are not forming, you have a problem of getting pregnant. Go a little further. You are in your late 40s or early 50s when you are reaching perimenopause. Again, because you are not having periods regularly, there is a hyperestrogenic condition and your endometrium grows too much. It can cause hyperplasia, and these patients are also prone for developing endometrial carcinoma. So this is the gynecological picture. But these patients are prone in their lifetime to develop type 2 diabetes, hypercholesterolemia, and many other metabolic problems. So it's like, that's why focus in the beginning that it's a syndrome. Don't just look at your acne or hirsutism or your periods. Remember that you need to take care of you for a very long time.
So how is this diagnosed? How does one make a definitive diagnosis?
Again, this is very important, because if I diagnose and say you have PCOS, I'm actually labeling you lifetime. Okay, because it's a condition that's going to be with you lifetime. So I should be very careful. I should not make this diagnosis very casually. We take 3 points. Number one is a menstrual abnormality. And often these patients should present with delayed cycles, as I just mentioned. Then there should be some evidence of hyperandrogenism, which means either clinically it will be hyperandrogenism like hirsutism or acne, or biochemically in my test, I will diagnose that you have more male hormones, which is normally present in us, but in these patients is exacerbated. And the third point is a very typical sonological or ultrasound picture saying you have polycystic kind of disease. There where caveat lies, many times it gets misdiagnosed. Lot of scan reports say PCOD like picture, and everybody thinks they have PCOD, which probably is not true. So we must look into the other two factors as well.
So another important question is, is it reversible? It's a lifelong condition, no doubt, but like how diabetes is often kept under control, is there some way to recognize it early and make sure that it does not cause these long-term complications, or does it get completely reversed?
No, no, no. I think well said. Just like diabetes, it's not reversible, but it's controllable. So I think lifestyle changes that we suggest is the best way to put this disease or this syndrome under control and prevent the long-term complications.
So do you think that weight management and physical fitness would actually do something to improve the condition? Do you think it will improve the cycles?
100%. 100%, because this is a counseling session I take, or we should take whenever we have somebody who we think is PCOS, because this counseling session will work lifelong with her. And I find many of these women come back to me and they will give their intermittent history in their life cycle also, that, that was the phase when I was exercising and my periods were better, but, I'm stressed out and too much work in office and now my periods. So I said, you have the answer yourself. You look into your own, and all they will say that before marriage, I was less weight, so I was not having that, and now I've gained weight. So I said, again, answer is with you. Go back to your weight, go to the right BMI, and you will get your period. So I think controlling this situation might be very much in our hands with lifestyle modification, and there is no doubt about it. We have to stress that.
So then I do have to ask you, you already mentioned a lot about the diet, but for the exercise part, I mean, this is something which busy working women do struggle with in incorporating that fitness and the steps and everything into their routine consistently. I think consistency is the problem there. They might do it in fits and starts. So what do you have? I mean, I'm sure with all your years of experience, you must have spoken to so many women. And would you like to share some tips with us on how, because this is just not for PCOS, but I think exercise is something which is pretty much any subject that we discuss boils down to lifestyle. So how do we actually get to the bottom of it?
Yeah, I know that's so. I would say discipline is very important. So if you can understand that word, you will be able to do it. But with that, if you are able to do something which you like, so choose an exercise which you will like. That is so very important. The second is like find a partner, to exercise with, and try and gel it in your day-to-day activity. So, for example, if you say, okay, I'll join the cult and I'll go at 6 o'clock in the morning, I'm sure 50% of the day you will miss it because something else is happening at 6 o'clock in the morning. But if you say, okay, at 6 o'clock I wouldn't go, but from 7 or 7:20, I'll just lock my room, put up Bollywood music and just dance. Probably that will work because you love dancing and it's just 20 minutes and it's a high aerobic activity and your heart rate increases and you did the job. You'll probably stick to that more. If you have somebody in your family who wishes to dance with you, it's much better. Or you have somebody who can play a badminton with you, is much better. But I think, or I sometimes tell to my patients that, see, you get 1 hour lunchtime, right? Keep your walking shoes in your locker. As soon as the lunchtime starts, don't eat lunch. First go 20 minutes walk in the corporates will sometimes have long corridors. 2 people just walk and just 20 minutes walk before you eat your lunch. I'm sure you can steal that time. So that is
needed is, I think, a bit of planning, and I think a bit of this all or none attitude we all have.
yes.
Either we do full hog or we do nothing at all. So I think, as you say, splitting it up and doing what we can really will help. Also, you did discuss about the dietary recommendations where you avoid a high calorie and highly processed food. But here again, a few practical tips on what corporate, in a busy corporate lifestyle, what could one pack for lunch, or what kind of, because there's always a lot of confusion about, again, an all or none phenomenon, like either you cut off carbs completely and then binge eat in the night, or it's like, overdo things or not eat it at all. And with the prevalence of a lot of eating disorders as well, I think it'll be nice to get a balanced approach.
Yes, I think what you have said is correct. People are working too many hours, so it's very difficult for them to manage their diet and food. What we could do is, first of all, cut down the carbs, which is so important. The second is pre-processed food should probably be made as minimum as possible. So I smile and tell my patients, if somebody has pre-cooked your food, probably that's not good for you. Even if you half cook your food and eat, it's much better. So try and develop a habit of at least making one meal yourself. So pre-processed food, high carb diet is out. But what you should add is high fiber and high protein. Now, how is protein going to help? Protein is going to help in twofold. One, it will keep you full for longer. So you don't want to, snack in between. So having an egg or nuts or something, paneer or something which is high protein will keep you better, say, having that breakfast. The second is protein will, with exercise, will help you build more muscles. And when the muscles are built, they are able to tolerate your sugar or carb load much better. So they will not spike your sugar or create this. The other thing that has come up in diet is all about the probiotics or the gut biome. I'm sure in every disease we are talking about. So I think even in PCOD or where diet plays a very important role, we need to look into it. So some kind of fermented food, either the regular food that we have is fermented anyway, so that's good. Otherwise, some kombucha or kimchi or so many or Indian fermented foods would go a long way if we can do. Mindful eating. So whatever you eat, we are all watching something and eating this today. So maybe a mindful eating, you'll eat less and you will be full more. So these are some of the tips which you can say. High fiber means adding more fruits and vegetables. It's no brainer. Everybody knows it. So only that we need to remember when we are doing that. So changing all this diet and ultimately doing little portion control. So what happens is when you have good food in front of us, it's that last that we take, we should avoid. So we kept our desire of eating the best food, but we did not overdo it. So that's discipline.
I think we can now discuss about, so we already spoke about the diagnosis of this condition. So apart from the lifestyle management, what are the treatment options? And is there anything that is particularly new in this field now?
Okay, so any patient with PCOS, the first line of management is always and always lifestyle. So that medication does not come prior to any lifestyle modification, and the medication will also work if the patient is also doing lifestyle modification. So that's the bottom line. We need to stress on it. As long as medication is concerned, we will have to see at what stage the patient has presented, what is her desire at that time, and what is she looking at. For example, there's a young patient of 22. Her main desire is that I should get my period every month. Then we need to do hormonal manipulation for it. I will guide her that, you do your exercise, you will get your periods more regularly. But in the interim, we can give her contraceptive pills or some hormone manipulation for her to get her periods in time. But you have a 22-year-old girl or 24-year-old girl. She said, I don't care if I get my period every 3 months, but take care of my hair. I'm embarrassed with my body image. So in that situation also, we can manipulate them with hormones, but we have non-hormonal medications as well. And they can also take some cosmetic treatment like laser or something like that to manage their hair. I see a dermatologist. Then she comes into a stage where she gets irregular periods, but she is looking for a pregnancy. In that, I can't give her contraceptive pills. I need to give her ovulation induction drugs. So I have to help her get pregnant. And then you have a patient in her 40s who's getting irregular cycles, but bleeding very heavily. What am I supposed to do at that point? I need to protect her endometrium. So I treat her again with hormones. Myoinositol is one drug which helps to improve the peripheral insulin sensitization. So we give that very often to patient. We also understand that this is a medically disorder where insulin resistance is the main culprit. We also give them metformin, which is so-called an anti-diabetic drug. So these are some of the medications that have come into which we, depending on the patient's presentation, desire, age, we may choose.
You were also mentioning how a lot of people walk into your office and think that they have this syndrome. But what are the common, are there a lot of myths and misconceptions about this condition? And is there something that you particularly like to debunk?
Okay. Every scan that says there is a PCOD does not mean you have PCOS. And I'm using this term PCOS because it's very commonly jargon used by women and girls these days. You need out, I told 3, and it's actually in our medical pharmacological Rotterdam's criteria. So there are 3 things I mentioned, out of which there has to be presence of 2 for me to say you have a PCOD. As I said, making a PCOD diagnosis is serious business, because then you have to be careful about it lifelong. So a scan report saying PCOD does not mean you are having PCOD. So that's the first myth I want to bunk. The second is, because this report said that, and you have probably say a little over extra BMI or overweight, they say, I'm not losing weight. Again, a myth. Actually, it's interconnected. The minute you lose weight, this problem gets controlled. Okay, so that's the second myth that they have. Of course, they do understand that can lead to infertility, which is not a myth, which is a truth. But it's one of the most easily treatable condition for infertility. You don't need to even go for artificial reproductive technology or something. All I need to is optimize you and give you ovulation induction. Again, those drugs will not work till you work hard with your exercise, losing at least 5% weight. When we talk about weight reduction, I tell, look at 5% weight reduction. I say sometimes don't want to embarrass you by even asking your weight. You calculate in your mind and work on 5%, because 5% weight increases insulin sensitization, reduces fat, especially the intraperitoneal fat, which again starts working like hormones for them. So it works that way.
So isn't that all women who are diagnosed with PCOS will also be having a weight problem, or are there people who would be also of a normal?
There is a small percentage of women in whom we call lean PCOS.
I think we have covered most aspects of it. Is there anything else that you would like to add, doctor?
I think what I would say, since it is also around the International Women's Day, IWD, PCOS is definitely glaring at you. But remember that PCOS is glaring because of the choices we are making for ourselves today, right? Nobody can change our genetics. We are born with some genes and some predilection to disease, but it's in our hand to keep them under control, make sure that does not progress to a problem where it's irreversible. These are some things that we need to take care of. Point 2, you are your own master. Nobody's going to come and tell you that, you take care of yourself. Okay, let's do this. We are the last people who take care of ourselves. But remember, if we don't take care of ourselves, how are we going to take care of people around us? It's like that aircraft analogy. You put your mask before you help anybody else. So I want all the women, all the ladies in this listening to this program, that put your oxygen mask first. I'm sure you can find 10, 20 minutes or 30 minutes of your time in the day. All your deadlines will be met. All your projects will pass. All will be happy at home if you remain happy. That's the only message I would like to give.
Thank you so much, Dr. Roma Sinha, as always, for giving us a very, very lucid picture of something that is in the minds of most women these days. And as we have seen, there are complications, people don't realize it. So I think this session has created much needed awareness. So thank you so much. And I do hope that you will all take heed of what doctor has said today. Be alert, be aware, and be the master of your own body, your own well-being, and your own health. Do reach out to us for any further assistance and queries, and we are present on all the social media channels and, of course, in our locations throughout India to assist you at any time. So thank you so much and namaste.
Namaste. Thank you so much.